Hello, everyone, and welcome to the Parkinson's Foundation's PD Health at Home Wellness Wednesdays. Thanks for joining us. I want to give some recognition to the PD Health at Home sponsor presented by the Light of Day Foundation, whose generosity has made this programming possible. Thank you, Light of Day. In today's PD Health at Home Wellness Wednesday webinar, we will break down the essentials of Medicare, including what's covered, what's not, how it supports people with Parkinson's, and how to navigate gaps in care. We'll also explore the intersection of disability benefits and Medicare, helping you or your loved one make informed decisions about available support and resources. And leading the presentation today is insurance broker Renee Harberts. Renee Harberts is a medical health plan specialist and licensed independent insurance broker, as well as a partner at Associated Professionals Limited, licensed in Minnesota with both local and national carriers. Renee brings over 25 years of experience in insurance and financial services with a dedicated focus on the Medicare industry since 2019. Renee is passionate about making Medicare understandable. She has a gift for breaking down complex information into clear, plain language, empowering us to make confident choices about our healthcare coverage. Her philosophy is simple. When people have the right information up front, they can choose plans that truly work for them or their loved ones. So please join me in welcoming Renee Harberts. Thanks for being here, Renee.
You are so welcome. Thank you. And thanks everyone for having me here today. It's a pleasure to share some information about Medicare. I know that Medicare can be tricky with all of its letters and parts. And I have been doing this since 2019. And I have to tell you that it has probably been the most rewarding career that I have had. I've helped hundreds of people to understand Medicare, and that's what I hope I can do today for everyone, is shed a little bit more light on the basics of Medicare. So with that, we will begin. So before I begin, though, I do need to do a couple disclaimers. So this is an educational session only. It's not an offer of any product, carrier, or specific product information. I am not affiliated or endorsed by the Department of Health, Human Services, or any government agency. While every effort has been made to ensure the information in this session is accurate, information changes fast and there could be errors or omissions. This is a broad overview of Medicare and not meant to have every detail included. We do not offer every plan available in your area. Currently, we represent 9 organizations and 46 plans. Excuse me. Please contact medicare.gov or Medicare or 1-800-Medicare to get information on all the plans. And so now that I've kind of done that, the objectives for today are really to understand the basics of Medicare, to understand what choices are, and then I'll just have a few little resources for people to help them find options and provider some services and some financial aid. So with that, what is Medicare? Well, Medicare is a federal insurance program for eligible U.S. citizens and legal residents. It's funded in part by taxes that people pay while they're working. So if you're looking at your pay stub, it's the stub that says FICA, FICA. It is individual insurance. There are no group plans, there's no family plans. Each person has their own plan and they qualify for Medicare with their own credentials. So Medicare is not free. There are premiums, there are co-pays, there are co-insurances and deductibles. We'll go into some of that just a little bit. Like I said, it is not a family plan, individual insurance, and it is not Social Security. Sometimes people get confused with Social Security and Medicare, and there's kind of a reason for that, which I will explain. But they're both programs, but 2 entirely different programs. Social Security is about financial support, and Medicare is health insurance. The reason that sometimes people get a little bit confused is because you sign up for Medicare through Social Security. Social Security determines your Medicare premium. And if you are receiving Social Security benefits, your Medicare premium will be deducted from your Social Security check. So it's kind of easy to see that people get them a little bit confused. Sometimes people get confused about Medicaid and Medicare, but Medicaid, while it is insurance, it's a state and federal run program, and it is a health insurance, but for individuals with lower income. So who can get Medicare? So you need to be a US citizen or a legal resident. Legal residents must live in the US for at least 5 years in a row, including the 5 years just prior to applying for Medicare. And then it also has a couple other requirements. So you must meet one of those. You must be age 65 or older. You can be younger than 65 with a qualifying disability. Receiving Social Security disability benefits for 24 months, you will automatically be enrolled in Medicare. And you can also enroll at any age with the diagnosis of end-stage renal disease or ALS. Sometimes people think it's only for people who are 65, but you can see there are times when you could be younger. And I'm just going to go over this a little bit because this is a situation that comes up really often. Right now, a lot of people work past age 65, and people oftentimes think they'll call me up or go, "Oh my gosh, I'm 65, I have to enroll, and I have group insurance that maybe I want to continue." So you may be able to delay enrolling in Medicare, or you may have to enroll. It really depends upon your employer. So if your employer has 20 employees or more and their health coverage is considered creditable, you do not have to enroll in Medicare when you reach age 65. You can wait until you retire. Creditable really just means that the prescription drug coverage on the group plan is at least as good as or better than what would be in a Medicare Part D plan. So that if you're over 20 employees, don't have to, but if your employer has fewer than 20 employees, you will have to enroll in Medicare. And it took me a little while to figure out why, but the reason is that if there's fewer than 20 employees, Medicare becomes the primary payer and your group insurance would become secondary payer. And if you don't have a primary or a first payer, the secondary payer does not have to pay. Sometimes they say they will, but they do not. So fewer than 20, you do need to enroll. And then if you would be covered by your spouse's employer, you just need to really check with that employer and find out what their coverage rules are. Sometimes they will not allow dependents to continue after they reach 65. Sometimes they will. Just make certain that people would check with that employer's group plan. And a little note down here that's important to note is that if you take part in any part of Medicare, you can no longer contribute to an HSA. This is in place for 2025. There is talk about changing this rule for 2026. But if you begin taking any part of Medicare and you contribute to an HSA, you will have to pay back what you've contributed. And there could also be a penalty for the contributions that you contributed. So, original Medicare is what we really talk about when we're talking about Medicare. Original Medicare has two parts, Part A and Part B. Part A is hospital, or I call it inpatient care. Part B is medical or outpatient care. So Part A helps pay for hospital and inpatient care. It is premium free for most people. If you or your spouse have worked and paid taxes for 10 years or longer, there is no premium. You cannot be denied coverage. It doesn't matter what your pre-existing conditions might be. You cannot be denied coverage. Coverage is nationwide. There is a deductible per benefit period, and I'll try to quickly tell you what a per benefit period is. It's a little bit different than what you typically probably think about in a group plan. So a benefit period, I'm talking with my hands, you guys, I don't know if you can see that, but can't do this without it. Um, a benefit period is when you go to the hospital and you're in stay for however long, could be a couple days, it could be a couple weeks, and then you're out of the hospital for 60 days in a row. That's a benefit period. If on day 61 you went back into the hospital, you would start a whole new benefit period and a whole new deductible. Hope that made sense. There are copays for hospital stays and skilled nursing facilities. There's coinsurance for inpatient respite care and durable medical equipment used at home. Like we said, Part B is doctor services and outpatient care. So anytime you're not an inpatient, you're on Part B. There is a premium for Part B, and it is adjusted for income. So the minimum payment for 2025 is $185 per month, and the maximum is $628.90. That is the maximum amount that people pay. When they're determining your premium, they look back at your modified adjusted gross income from 2 years ago and determine what your monthly premium will be. So for 2025, they're looking back at your income in 2023. So sometimes you can even do a little income planning in there, because $628 times two, that's per person, ends up being a fairly large premium. Again, Part B, you cannot be denied coverage. Doesn't matter what your pre-existing conditions are. Coverage is nationwide. There could be a penalty for late enrollment unless you have a qualifying special enrollment period. And the delaying after you work is considered a special enrollment period. And there's a few more that we'll go over in a little bit. Part B is a coinsurance plan. It's an 80/20 plan. So while we said Part A had co-pays and coinsurances, Part B is an 80/20 coinsurance plan. So if you had a bill of $100,000, Medicare would pay 80,000 of that and 20,000 of that would be yours. If you had $1 million bill, 20% would still be yours, and there's no financial cap on that. So that is the reason, a big reason why people look to get additional coverage, because there's no financial cap. It's an uncapped financial risk. So now we're going to go into more details about Parts A and Part B, and we'll start with our Part A. We said it's inpatient care, so it covers your hospital room and board. It covers all your special care units and intensive care, all your prescription drugs, medical supplies while you're an inpatient, lab tests, X-rays, any kind of medical equipment, your operating room, recovery room, skilled nursing services, blood transfusions, hospice care, part-time skilled care for the homebound after a qualified inpatient stay, and rehabilitation services after a qualified inpatient stay. And I'm going to try to explain to you briefly what a qualified inpatient stay is. Basically, it means that you have been in the hospital as an inpatient, not in observation status, for 3 midnights. And this is important because that 3 midnight rule comes into play later on, how you qualify for some other services. So if you go into the emergency room, you're probably going to be in observation status until a doctor admits you into the hospital. Sometimes actually you could be in a room and still be in observation status. So it is very important that you know that you are inpatient status. And the hospital's doctors do have to let you know what your status is. So they're required to let you know. So kind of as we've gone over Part A, the pieces for Part A that are particularly important for people with Parkinson's is you're probably going to have or could have some hospital stays, your inpatient surgeries or treatments, any neurology surgeries, home health care after a qualifying inpatient stay. Again, that's where that qualifying inpatient stays. So It includes your physical, occupational, and speech therapy. And I'm going to make a little note here too. When it says home health care, notice that it says healthcare. Sometimes people think it just means home care. So, like your ADLs, so helping people with their meals or toileting or transferring. It does not mean that. It means skilled care. There is not coverage under Medicare for just plain home care. There's a little caveat to that, but we don't have time for that today. But know that home health care means skilled care. Part A for skilled nursing facilities and care for a limited time following a qualifying hospital stay. And there is care for some hospice coverage. Notice I will make a note too that hospice care does not include room and board. It just includes your meds, managing your pain, and some services, but it does not include room and board. So we did A. I'm trying to hurry just a little bit through some of this, so bear with me. I'm hoping to get done in time so that we have a little bit of time for questions and answers. So I'm going to speed through this just a little bit. Part B is, like I said, outpatient care. So it includes your doctor visits, even while you're in the hospital, but anytime you have a doctor visit, a specialist visit, that's covered under Part B. It includes an annual wellness visit. And an annual wellness visit is not an exam. It is just a time that you could go into, meet with your doctor, tell your doctor, and you have a conversation about your concerns, about your general health, and do a wellness plan for you. So it includes a wellness visit once a year. It includes preventative services like flu shots, mammograms, colonoscopies. Those are all preventive services. There's many preventive services. There are clinical laboratory tests like your blood tests, urine tests, diagnostic tests, x-rays, MRIs, CAT scans, some health programs. There is physical therapy, occupational therapy, speech therapy services covered under Part B, diabetes screening, and some education around certain supplies, mental health, durable medical equipment for use at home, like wheelchairs, walkers. There is coverage for ambulatory surgery centers, ambulance service, and emergency room services. And sometimes people say, Renee, what the heck is an ambulatory surgery center? And it is, instead of going to the hospital to have a surgery, you go to a surgery center. So, really, oftentimes people have hip replacements, knee replacements. They don't go to a hospital, they go to a surgery center. And then there is coverage for telehealth visits. And as Part B kind of relates to Parkinson's outpatient service, it is, your labs, your diagnostic tests, any outpatient surgeries, doctor visits, your specialists, your neurology services that you might have, your CAT scans, PET scans, MRI, again, medical equipment, um, respiratory equipment, again, some home health care without prior inpatient stay services. So sometimes there is coverage for home health care under Part A and Part B. They just have different circumstances. And your medications that are administered in a doctor's office or a hospital setting. So this is different from prescription drug coverage Part D, where a doctor writes a prescription out and you go pick that up at a pharmacy. This is for medications that are administered in the doctor's office. Chemotherapy is one that really oftentimes is a Part B drug. So while we covered a whole lot about what Medicare covers, original Medicare Parts A and B don't cover everything. And services must be considered medically necessary. I'll give you an example of that. And then I also have a little definition because people ask me, Renee, what's medically necessary? I'm going to read it to you. So, medical necessity refers to healthcare services that are essential, appropriate, and meet recognized standards of medical care for treating a specific condition, and they must be ordered by a doctor. So, here's an example of sometimes when something might be medically necessary. or not. So, cataract surgery is considered medically necessary, and there's a standard lens that gets used to correct a cataract. But sometimes I have actually a number of clients who have astigmatism, and there's a specialty lens that they can get to help correct that astigmatism. Medicare does not consider the astigmatism lens medically necessary. So that's a time when something medically necessary, when it's not deemed medically necessary, I guess is what I'm trying to say. So it doesn't cover everything. There are out-of-pocket costs. It does not cover prescription drugs. It does not cover routine hearing, vision, and dental. So if you just went into a to the doctor and or the eye doctor and wanted to know if you see 20/20, that's routine, not covered, but there is coverage for cataract surgery. There is for macular degeneration, so medically necessary. There's not coverage for eyeglasses, contacts, or hearing aids. There's not coverage for long-term care or that home care, custodial care, like help with bathing, eating, and dressing. It does not cover excess charges for services by doctors who don't accept Medicare assignment. Okay, and so what this means is if a doctor does not accept Medicare assignment, really means that a doctor has not agreed to having what Medicare says it's going to pay. They don't accept that payment as payment in full. And so they could charge you if you went to a doctor who didn't accept assignment, they could charge you excess charges of up to 15%. In Minnesota, we don't allow that, but in other states they do. So that is something that Medicare does not cover. Original Medicare does not. And it does not cover care received outside of the US except in certain situations. And what that really means for the most part is there is coverage for emergency situations. So now we come to what is really the most important piece of this, in my opinion. This is what I help clients with. This is what I spend the most amount of time with people on, is understanding, helping them understand what their options are. So they have parts A and B, which are the federal government programs. But then we talked about all those co-pays, co-insurances, the 80/20 plan, no financial cap. So they need to pick up some additional coverage. And there's basically kind of two options for how they do that. And I will go over those in more detail. And this is probably the most important part for people to understand. So you have kind of two options. So you have original Medicare A and B. We said it didn't cover prescription drugs, so you can pick up a prescription drug plan, add that to A and B, and you can also add a Medicare supplement plan that picks up those copays and co-insurances that original Medicare leaves for you. Both of these, Part D and Medicare Supplement, are offered by private insurers. They are not part of the government program. If you don't go that route, you can do option two, which is to purchase a Medicare Advantage plan or also a Part C. You'll hear those names used interchangeably all the time, again, offered by private insurers. So Part C really takes original Medicare Parts A and B, combines them into one plan, calls it Part C. Typically, there will be drug coverage included in that plan, and there'll also oftentimes be additional benefits that original Medicare does not cover. So now I'm going to go into a little bit of detail about all those options that we said you could add to original Medicare. So the first one we're going to cover is a Medicare supplement plan or a Medigap, also used interchangeably. You'll hear them all the time. It works with original Medicare Parts A and B and Medicare Part D. It can't be used to pay for Medicare Advantage costs. It can't be used with, you can't have a Medicare supplement and a Medigap plan and a Medicare Advantage plan at the same time. Medicare supplement plans are standardized by federal and state law. And what that means, kind of hard to explain, but what that really means is that if you bought a Medicare supplement plan, and there are different types of Medicare supplement plans, a lot of them have letters. It could be Plan A, Plan G, Plan N, Plan F. If you bought any one of those plans, let's say you bought Plan G from carrier XYZ, that plan and coverages would be exactly the same regardless of what insurance company you bought it from and also which state you bought it in. So they're standardized. You buy a plan, it's the same plan, same coverage with whichever carrier you have. The only thing that probably will change is the premiums that you'll pay. So in Minnesota, we don't have quite as many of the letters as all the other states have. We standardize a little bit differently here. We basically have a basic plan, a plan with riders, and an extended basic plan. Um, and we said that they're offered by a private insurance, not by your state. Um, Medicare supplement plans will help you pay for your hospital co-insurances, your skilled nursing co-insurance, your Part B co-insurance or co-pays, the cost of blood transfusions, 3 pints, the cost for extra 365 days of hospital care. It will pay for your hospice co-insurance. It will pay your Part B deductible, Part A deductible, little asterisks there for Part B deductible. Anybody that has been eligible for Medicare since 2020 cannot get a plan that, well, let me see how I can say that better. There's no way to get rid of the Part B deductible. And in 2025, that deductible is $257. So it's a yearly $257 deductible. And there's no way to get a plan that you can get rid of that. Prior to 2020, your plans did not have that deductible. Um, it will help pay for foreign travel, emergency care, and it will take care of those, it will cover those excess charges that we talked about. We already talked kind of about what it will not cover, so I'm not going to go through that again. Some facts about a Medicare Medigap plan is you must be enrolled in both A and B and live in the state where the plan is offered. There is no medical underwriting up to 6 months after enrolling in Part B and at age 65 or older. And so, kind of what that means is during those 6 months, you can get a Medicare supplement plan and you won't be underwritten. It will not matter what your pre existing conditions are. After that time, you may not be able to get a Medicare supplement plan because then they will put you through underwriting, and if you have pre-existing conditions, there's a list of them. If you have some of those pre-existing conditions, you may not be able to get a Medigap or a Medicare supplement plan. Or sometimes some states, Minnesota, we're a pass or fail. You either can or can't, but numbers of states will let you get a Medicare supplement plan, but they might charge you an extra premium. Probably the biggest reason and the most important reason that people choose a Medicare supplement plan is there's nationwide coverage. You can take this plan with you to any state. You can see any doctor. There are no networks. So that I can't stress how important that is. And maybe even to folks with Parkinson's, you want to make certain that your doctors, your specialists, you can go see. So with a Medicare supplement plan, as long as your doctor, your facility accepts Medicare as a payment method, you can take your plan with you. I have a client who's moving to Wisconsin, lived here in Minnesota, moving to Wisconsin. She's going to come back here to Minnesota for her care, and she can do that with her Medicare supplement plan. It is guaranteed renewable as long as you pay your premium. We kind of talked about that you pay plan premiums, and they may vary for some some of the letters. Some letters of a plan cost more or less. Plans with a higher premium generally have better coverage, and you must continue to pay your Part B premium. Lots of times people think, oh, I'm picking up this Medicare supplement plan, which has a fairly large premium, so I don't have to do my Part B premium. Those Part B premiums are yours forever. So we talked about that you could add a Medicare supplement and to our option one, and then a Part D prescription drug coverage. So, and there are two ways to get your prescription drug coverage. And the two ways are either a standalone Part D, or like we mentioned, that a Medicare Advantage plan oftentimes includes prescription drugs. So two ways that you can get them. You can add a standalone or get it through a Medicare Advantage plan. Um, but regardless of what kind of how you get your Part D, your prescription drug coverage, they will all have a formulary, which is a list of prescription drugs that are covered by your plan. And they will all have tiers and formulary tiers. And most of the time they will tier just like this, tier 1 through 5, with tier 1 being your preferred generics, tier 2 your generics, tier 3 preferred brand, tier 4 non-preferred brand, and then tier 5 a specialty. And as you can imagine, the higher the tier, the higher the cost. Um, and oftentimes, prescription drug plans have deductibles that they charge by tiers. It's not been unusual that many prescription drug plans don't have a deductible for tiers 1 and 2, but start at 3, 4, or 5. I anticipate that there will be some changes in 2026, particularly around prescription drug coverage. So I don't know how those deductibles will end up falling in for 2026. We will know more about plans in probably the end of September. Can't talk about them, however, until in October. So, with some rules, you must be enrolled in Medicare Part A, B, or both. And you'll notice that this is just a little bit different. We said for a Medicare supplement, you had to be enrolled in A and B. And for your prescription drug, you A, B, or both. You may be required to use a pharmacy network. More often than not, what I've seen is that there's a preferred network, and your copays will be less if you use a preferred network. And your drug coverage, your company will let you know what those preferred pharmacies are, and it's important, especially for probably people with Parkinson's. You might have some expensive specialty drugs. Make certain that you use a preferred pharmacy because you'll pay less that way. So important to check that out when you're purchasing a drug plan. Coverages vary by cost and vary by plan, and they may change each year. And I can tell you that as long as I've been doing this, it's not that they may change, they always have changed. Costs have changed, coverages have changed, deductibles have changed, formularies can change. Formularies can change during the year too. But anyway, they do change often, yearly. And so again, I can't stress enough how important it is that you check your plan. Um, there is a Part D penalty for late enrollment unless you qualify for a special enrollment period, which was the one that we talked about, delaying or not delaying when you leave your group coverage. There's also a couple more times that I will go over in just a bit. Um, Medicare Advantage is another way to get your Medicare benefits, an alternative to A and B. Plan members are still in the Medicare program, but the benefits are administered by the plan. And that's kind of what really those first three statements were really saying. So, original Medicare and a Medicare supplement plan are still administered through the federal Medicare plan. With a Medicare Advantage plan, you have it's a managed care plan. So really your insurance company manages your payments and manages how your benefits are going to be delivered. So you still have all the advantages of the original Medicare system, but a Medicare Advantage plan now is offered by private insurance companies, and they're the ones who really administer your plan benefits. And as an example, if you have a Medicare supplement plan and you go to the doctor will bill original Medicare, it will pay its portion, and then they'll bill your Medicare supplement insurance company. But first it goes to Medicare, then to your insurance company. With an Advantage plan, how it works is you go see the doctor and they bill your insurance company. It doesn't go to original Medicare first. Okay. So we said that a lot of them have built-in drug coverage, and many plans will offer additional health benefits like they do cover routine hearing, vision, and dental. And they will all have an allowance for you for dental coverage and vision coverage and eyeglasses. They might also have coverage for some over-the-counter benefits, so they will all give you a $50 a quarter amount that you could go into your local drugstore and get vitamins or suntan screen, band-aids, different kinds of additional benefits. So Medicare Advantage plans will do that. Medicare supplements will not. Oh, I forgot to mention that most Advantage plans will offer fitness programs and gym memberships. And actually, by now, so will most Medicare supplement plans will also offer gym memberships. We kind of said that those extras we've kind of already gone over that an Advantage plan might cover. Some important things to know about qualifying here is you must be enrolled in both Part A and B and live in the plan's service area. If you noticed, we said that for the supplement, you need to enroll in your state. For a Medicare Advantage plan, there are service areas. So, for instance, the metro is a service area, the southern part of the state is a service area, the northern part, the eastern part. And so, if you live in the metro, you couldn't purchase a plan from the southern part of the state, and it'll operate that way in any state. So, you must live in the area that your plan is being offered. You cannot be denied coverage based on your current financial or health status, including any pre-existing conditions. There's no pre-existing conditions. You can sign up for a Medicare Advantage with any pre-existing conditions. Um, Now, here you may be required to use provider networks and provider pharmacies. And so this is really, really important if you're going to do a Medicare Advantage plan, especially for people with Parkinson's. Please make certain that your providers that you want to see are in your network, your specialists are in your network, your drugs are in your network. Really, really important. I can't stress that enough. Um, Coverage and cost may change by plan and by year. And like I said before, I've never seen them that they don't change. So, um, you know how I said that Medicare supplement plans were standardized? If you bought this plan, it'll be the same. With Medicare Advantage plans, every insurance company offers many plans and they will all be different. You'll pay a different premium. You'll have a different copay. You'll have different co-insurances with those plans. So really important to check all of those out. That's really what we do as agents is in the fall now, we will learn what the new plans will be for 2026. So we examine those and get back to our clients and go over how plans have changed. People will also get a notice of change if they have a Medicare Advantage plan in the fall. they will get a notice. It's called an annual notice of change from their insurance carrier that will let them know what's changed from one year to the next. So sometimes people just toss those out. They don't pay any attention. Important to pay attention to what those changes are. Um, there's an annual limit on out-of-pocket costs for covered service. So it's a max out-of-pocket. And what that means is, regardless of what that is, it might be $3,000, it might be $5,000, it might be $8,000. Once you've reached that annual out of pocket, the plan now picks up all the rest of the costs for your services. So it does have a financial cap on it. Um, the Medicare Advantage plans, it says may charge a monthly premium. There are zero premium plans available. They are not bad plans either. Um, but there are zero premium plans, and I've seen some plans go up as high as maybe almost $200 a month, but probably a more average premium might be $50, something like that. But there are some zero premium plans, so that's good to know. And again, you must pay that pesky Part B premium. I'm gonna see kind of how we're doing with time here. This is kind of just a sort of analysis, kind of a cost comparison, not even just a cost coverage comparison of Medigap versus Medicare Advantage. So we said that a Medigap plan really pays some of the costs not paid by original Medicare. Depending upon the plan that you get, you can really cover all of your costs except for that annual deductible. We kind of went over all of these things. The biggest important thing again is with a Medigap plan, there are no networks. You can take that plan with you to any state, any um, facility, doctor that accepts Medicare. Really important. Um, Medicare Advantage provides benefits beyond original Medicare. We talked about all the extras that it might cover. Those are valuable. I can tell you that really oftentimes people are really interested in the dental coverage. That is a big driver for lots of people. So Medicare Advantage plans offer dental coverage and eyeglasses that are important to people. Um, what else in here? You again check your networks. You know, one thing that I was going to mention, let's see if I can explain this kind of quickly. So Medicare Advantage plans will say that you have in-network and out-of-network. And if you use an in-network doctor or you have an in-network service, maybe your copay will be $20. You go out of network, maybe it will be $40. And so they say that you can go in or out of network, and you can, definitely. But the other little caveat around that is out of network really means that whoever you see that's out of network does not have a contract with that carrier to to accept your plan. So it could be that you want to go out of network, but the facility that you're wanting to go to says we're not accepting your plan. So really, again, important to know that the people that you want to see, your specialists that you want to see, are in network. We said that a Medigap plan has a monthly premium. Medicare Advantage plan could have a premium. You know, here's another way that I explain this sometimes. I think of a Medigap plan as a pay up front. You pay a larger premium for your Medigap plan. When you go to use it, you can get that so that you really have no costs associated with it except that deductible. A Medicare Advantage plan is a little bit more pay as you go. You pay much less for the upfront premium, but when you go to use those plans, now you have co-pays and co-insurances. They do always have a max out of pocket, so you do know that you have downside risk on that. As far as convenience goes, a Medicare Advantage is an all-in-one plan. So when you go to your pharmacy, when you go to your doctor, hospital, you just show them your Medicare Advantage plan from your insurance company. With a Medigap plan, you're going to have a card for your prescription drugs. You're going to have a card for your Medicare supplement, and you will need to show your red, white, and blue, your original Medicare card. However, once you've been there, they pretty much know those. So here is a little graphic of the combinations that we've talked about. You start out with original Medicare Parts A and B, your option to add a Part D, to add a Medicare supplement. You could do one or the other, but really what people want to do, what in my opinion they should do, is to have A and B plus prescription drugs and a Medigap. If you choose not to go that route, you do a Medicare Advantage plan, and for the most part, they will have prescription drug coverage in them. And there are some Medicare Advantage plans that do not include prescription drugs, and people pick up their prescription drugs outside of a Medicare Advantage plan. And when I've seen those, most of the time is really when people are getting their prescription drugs through the VA. So just some terms that you probably know, but we'll quickly go through them. Premium is a fixed amount that you pay for coverage, usually monthly. A deductible is a set amount that you pay once that you pay for services before your plan begins to pay. A copay is a fixed amount that you pay at the time of that you receive a service. So it could be a flat $20, $50, whatever. Co-insurance is just that, it's a percent. The carrier or Medicare will cover X amount, 80%, and you pay 20%. Some services inside of a Medicare Advantage plan will have co-insurances as opposed to a flat copay. I'm not going to go over this too terribly much because we kind of went through this. We said that Medicare Advantage plans can have a low premium. Prescription drug plans as a standalone will have a premium. They will have copays, deductibles, co-insurance. A Medigap, a Medicare supplement will have a higher premium. They'll have that one-time yearly deductible. And there are some plans that have co-insurances and co-pays, but you can also buy plans that don't have those. And we're going to move right along to when can you enroll. So most people enroll during their initial enrollment period, and that is a 7-month window that starts 3 months before you turn age 65, when you turn age 65, and 3 months after. If you are receiving Social Security or Railroad Retirement Board benefits at age 65, or if you're receiving Social Security disability benefits for 24 months, you will automatically be enrolled in Social Security. Sometimes people will just get their Social Security card in the mail. Like, why did that happen? It's because one of these 3 things is happening for you. If you're not, you must enroll yourself. And the easiest way to do that is to enroll online at ssa.gov. You can go to your local Social Security office or call, but the easiest way is really to do that online. Do it early to avoid gaps. I can't also stress that enough, to make certain you can enroll ahead of time so that it will begin when you turn age 65, but you can enroll 3 months before, and you just say that I want it to start on the first day of the month that you turn 65. So get that in place before you lose your coverage or before you turn age 65. You will need to enroll in a Medicare Advantage and Medigap Part D plan directly with the insurance provider. We're getting close, guys. If you missed your initial enrollment period, there is a general enrollment period where you can enroll in Parts A or B or both from January to the end of March. You can choose to enroll in a Medicare Advantage plan or a prescription drug plan from April through June. And if you've missed some of those enrollment plans, those enrollment periods, you may very well have a late penalty. There is a Medicare supplement enrollment period, which lasts 6 months, beginning the month in which you turn 65 or older and enrolled in both parts A and B. And during this time period, there is no medical underwriting. I think we kind of went through this, but during this initial enrollment time here, when you first become eligible, you can get your Medicare supplement, no questions asked. After that, you could be denied or charged a higher premium. So it's important that people make that decision early on as well. We kind of talked about the special enrollment period for people working past age 65. So you do have an 8-month window from the last month of employment or the last month that your employee coverage ends. But you only have the first 2 months to enroll in a Medicare Advantage plan or a prescription drug plan. And you have exactly 63 days to get a standalone prescription drug plan or Medicare Advantage plan with prescription drug coverage without penalty. So, while you have 8 months, you really only have two because, whoopsie, because you need to have, sorry, I got to go back. I don't know what I did there. Yeah, because you need to be enrolled in parts A and B to enroll in C and D. We talked a little bit about late enrollment penalties. There is, most people qualify for premium free, so the penalty doesn't really come into play. There is a penalty for Part B, which is 10% of the monthly Part B premium for each full 12-month period that it's delayed. And for Part D, there is a penalty of an additional 1% of the average Part B premium for each month you delayed. And those penalties stay with you. They do not go away. So as long as you have Medicare, you will have those premiums. Sometimes people think, well, that penalty is just for this year, but no, it remains with you. So, when can you change coverage? So, this is the time of year, October 15th through December 7th, which is known as AEP. It used to be, people called it more Medicare open enrollment. Now, for the most part, it's called annual enrollment. It's kind of when you see all the advertisements on television. And this is the time of year when you want to evaluate your plan, you want to talk with your agent and make certain that you have gone over your plans for the year because this is the time of year if your coverage has changed so that it's not beneficial for you anymore. You can join, switch, drop a Medicare Advantage plan or a prescription drug plan. You can switch from original Medicare Parts A and B to a Medicare Advantage plan or vice versa. You can switch from one Medicare Advantage plan to another, and you can make as many changes as you want during that time period. But whichever is your change, your choice on December 7th, that's going to be your plan for the next year starting January 1st. So you can do those changes during that time period, and those plans then start January 1st of the next year. There is also a Medicare Advantage open enrollment period, and this is available only to people who have a Medicare Advantage plan. And they can switch from a Medicare Advantage plan or return to original Medicare Parts A and B. They can enroll in a standalone Part D prescription drug plan. They can return to original Medicare, but there is only one change allowed during this time. The other time we said as many as you want, only one during this time period. We talked about some special enrollment periods that are qualifying life events. So those events are moving. If you move, you'll have a special enrollment period. If you leave retiree coverage or union or coverage coverage, you will have a special enrollment period. And in most cases, you have 2 full months after the month of the qualifying event to make plan changes. So during this time, you may join, change, or drop a Medicare Advantage plan or prescription drug plan outside of the Medicare annual enrollment period without penalty. So lots of times we have people that from Minnesota that move to Florida or actually move from Florida back to Minnesota. So they have a special qualifying event to make changes. There are some financial assistance programs available. There's something called LIS or Extra Help that helps pay for your prescription drug costs. There is Medicaid that provides health coverage for people and families with limited incomes, and it varies by state. In Minnesota, we don't actually call it Medicaid, we call it medical assistance. There are some Medicare savings programs that will help pay for Part A and B costs. And there is also a PACE program that provides care and services for frail and elderly people living in the community. And you can call your state SHIP department. These folks, I cannot say enough good about. They know these plans, they're super helpful. They're very engaging. If you want to know about those plans, that's the place to call. There are more resources. Visit medicare.gov, call 1-800-Medicare. Again, call your state SHIP department, contact your local Social Security or Medicaid office. And with that, thank you. And again, I just cannot stress enough the importance for everybody to review their plans during AEP, which is coming up in October, and call your agent, work with an agent, work with me. There are many great agents out there. Check your plans. And thank you so much. And I don't know if we have questions at this point in time.
Thank you, Renee. Really appreciate your support in outlining how we can navigate this complex system of healthcare coverage through Medicare. We do have just a few minutes left, and I apologize for our limited time. But I want to focus on, and Brianna, if you could end share screen, please. Focus on disability so we can get some parts of that aspect on this side of coverage addressed. So the first question we have, Renee, is what if we're not old enough for Medicare and are getting ready to apply for disability? Can you expand just a little bit on the difference between Medicare and disability?
Well, a disability is not my area. If I wanted to know about disability, what you need to do to qualify, there are some real specific rules about qualifying for disability income assistance. I would call my state departments, my SHIP departments, and just ask them what you all need to qualify, what you need to do to qualify for disability help. I'm sorry, that's just not kind of my area of expertise.
I appreciate your acknowledgement of your scope of practice and also giving us a resource to tap into. There's many experts in the layers of navigating healthcare coverage and disability. So thank you for directing us to calling the SHIP departments, and hopefully that was helpful.
Or Social
Again.
Security will help with that as well.
Yeah.
Someday I keep saying that I'll delve into that, but I have not yet.
Yeah. Someday, someday. Great. Well, everyone, you have Renee's phone number. It was on the last slide that she shared. Those slides will also be shared with you and our post-program email address. There's so much to be uncovered in navigating Medicare and what that means for your unique needs. So I really encourage you to reach out to Renee to support you in answering these unanswered questions due to our lack of time to get to them. So thank you for your patience. And also thank you for your presence, everyone. I really appreciate you showing up to learn more about this complex system of supporting ourselves through later stages of life. So thank you so much, Renee, for your support, and
You're
thank
so
you to
welcome.
all of you for being here today. And before we close, just want to remind you about our other PD Health at Home virtual programs. Each week, we offer sessions tailored to support people with Parkinson's and their care partners. That includes Mindfulness Mondays, Wellness Wednesdays that tap into the various deep depths and subjects of Parkinson's disease. We also have Fitness Fridays, which our live session is this Friday. Join us in Movement this Friday, our expert briefings, and Spanish language series, EP Salud en Casa. Be sure to visit our website to see what's coming up and to explore our archive videos on YouTube. And if we didn't get to your question or if new ones come up as you process the information, know that we're here to support you. You can visit our website at parkinson.org for a wealth of resources on Parkinson's disease or reach out to our expert team directly. You can call our helpline at 1-800-4PD-INFO or email us at helpline@parkinson.org. Thank you so much for joining us today. Together we can navigate this path and continue building a brighter future. Again, thanks for being with us, and we look forward to connecting with you at future programs. If you have any questions or need additional support, don't hesitate to reach out. Take care and be well.